C5, C6 disc bulge, or C5, C6 bulging disc, or C5, C6 disc herniation. No matter which way you call it, or no matter which way your MRI report says it is, if you get a disc injury in the mid part of your neck at C5, C6, that can be a very big source of neck pain, disability due to neck pain, and also other symptoms like shoulder tension, arm pain, and numbing tingling into the hands and fingers. In this video, I'm going to give you my 3 best exercises to help with a C5, C6 bulging disc. Hey, it's Dr. Walter Salubro. I'm a chiropractor in Vaughan, Ontario, Canada. And I've been a chiropractor now for 20 years. And in my office, we've helped hundreds and hundreds of people with chronic spinal conditions. So we help people recover from chronic conditions like disc bulges in their lower back, disc bulges in their neck, conditions like sciatica or leg pain, arm pain, numbness and tingling, and even things like neck pain, headaches, and other conditions like scoliosis and bad posture. And in this video, not only am I going to give you my 3 best exercises to help with a C5, C6 disc bulge, but I'm also going to talk a bit more about what a disc bulge looks like in the neck area, what's one of the primary causes or the main cause of bulging discs in the neck. And at the end, stay tuned to the end because I'll also give you some tips and information on how we apply corrective methods to help rehabilitate a spine back to improved position and function and structure and alignment, so you could minimize not only the current pain that you have in the neck or arm, but also prevent it from getting worse in the future. Now, if you're new to my channel, I want to invite you to subscribe by hitting that subscribe button below. Also click on the notification bell and turn on the notification on your devices as well. Because each week I put out new content on how to relieve chronic pains, whether it's back or neck or arm or leg pains, how to improve quality of life through corrective chiropractic methods and exercise and tips that I give as well. So be sure to join this community. We're approaching 58,000 subscribers. If you're already a subscriber of my channel, I want to welcome you back and I thank you for your support. This channel is for all of you. Now, before I give you my 3 best exercises for C5, C6 bulging disc, I want to just elaborate a bit more about the anatomy behind a bulging disc, the anatomy of the cervical spine, which is the neck. I did elaborate on this in a 17-minute tutorial on a C5, C6 bulging disc treatment without surgery. You can find it right here up in the card or in the description below. But I want to give you a short segment in this video training to show you what a normal neck spine looks like, and then what a spine that's out of alignment looks like and how that contributes to bulging disc. And then I'll get into the exercises, so stay tuned till the end. So if you look at this poster here, this poster is provided by Chiropractic Biophysics, which is one of the primary techniques we use in our office. I'm certified in Chiropractic Biophysics. It's a corrective care, chiropractic care type full spine rehabilitation technique. And so this is provided by that group there. It's a great educational poster. If you look on this side here, this is a picture of the cervical spine, which is the neck from the lateral aspect. So a person, when they were taking this picture, was taken from the side facing that direction here. So the back of the head is here, and here's the jaw. These white blocks are the bones. The spaces in between, those would be the disc spaces. You don't see discs on an X-ray, but you see the spaces. They should be nice and wide. Generally speaking, when the spaces are nice and wide, they're generally healthy and generally have no injuries or problems there. This green line is a template line. That's the normal alignment of the cervical spine. The cervical spine has a natural circular curve from the side. It approximates the shape of a circle. This has been documented and validated through spinal research. It's all in the literature. So we know what the actual spine should look like from the spine. We know what the actual ideal measurements are of this arc. We know what the average measurements are. So literally a patient comes into my office with neck symptoms or neck problems or arm symptoms. I can take an X-ray of their neck, and if it's not looking like normal, I can measure what their neck is, see how far away it is from normal, and then apply corrective techniques to get it closer to normal. Why is all that important? Well, what's inside the neck? What's inside the spine? It's the spinal cord. Why is that important? The spinal cord comes from the brain and it gives power and energy to your entire body. Without the connection from brain to body, then you cannot function fully as a human being. It controls your organ systems, it controls your healing and your repairs. So when the neck is aligned properly, then there's good flow from brain to body with little to no interference on the nervous system. When it's out of position, so the red line here is where the neck should be, and the dashed line over here, it's red in case you're colorblind. It's the dashed line is the neck alignment, and the solid line is the normal arc where it should be. So this is a neck that's significantly out of normal position. Over time, span of 10, 20, 30 years, it caused degeneration on the joints and on the discs as well. In fact, these discs are completely compressed and degenerated. So if someone took an MRI of this, it may show disc bulges. So one of the most common causes of disc bulges in the neck is not so much immediate trauma or acute trauma. That could be an injury like a whiplash injury or fall or sporting injury to the neck and back. But this is most likely this most likely has developed over many, many years due to a lot of different reasons. It could be poor posture, it could be repetitive motions, cumulative traumas. It could be a lot of different reasons. What's important is not so much how it got there, but what are we going to do about it when we catch it? And catching it is also important. So this is one of the main reasons of disc bulge. So I'm going to show you another poster now to see what a disc bulge looks like actually on an MRI picture, because on X-ray, you can't see a disc bulge on an X-ray. You can see the degeneration and the misalignments, but you need an MRI to confirm a disc bulge. Clinically, how a disc bulge typically shows up when it's a neck problem will be serious, severe neck pains and also numbing, tingling into the fingers. When there's acute neck pain over here, then most likely it's going to be a disc bulge symptom situation, and then we need to confirm with an X-ray. So I'll be back in a second. I'm going to switch the posters around and you'll see another poster of what it looks like, a disc bulge on an MRI. Okay, and I'm back. So here's another poster as well by the Chiropractic Biophysics groups, great educational poster. On this side here, now the colors of the lines are different. So the solid line, it's a red line. The solid line would be what normal should be. There's an X-ray. The person's looking towards that direction from the side. The dashed black line is the alignment of the individual here. So you can see it's way off alignment. That's a serious problem. And it's actual reversal buckled spine, which is a major contributor to disc injury and disc bulges in the necks. Why C5, C6 is the most common? Because C5, C6 is what we call the apex of the cervical curve. It's the height of the cervical curve, the main deep part. So it's the most mobile area and the most susceptible to degenerative changes and also disc injuries when it's out of position. So that's why this is showing here, this major area here. So we have C1, C2, C3, C4, C5, C6. Major reversal of alignment and also disc compression. And on an MRI, we show a disc bulge. Now, here's a picture of an MRI, and it may not be the same person, but the idea is the same, okay? So we see a neck position, so from the side position, facing that side. And the nice thing about an MRI picture is that we can see the actual soft tissue. So the white blocks are the bones, the black areas are the discs. And on the inside is the spinal cord. That dark band over there is the spinal cord, which connects your brain to your body. That white space is the fluid, the cerebral spinal fluid. Super important cerebral spinal fluid. When your brain has a lot of metabolic activity. So anytime there's high metabolism in your body, there's metabolic toxins and byproducts that are released through those reactions. And they need to be detoxified and eliminated. So the cerebral spinal fluid pump and flow helps to detoxify the brain and nervous system. So super important. So we don't want that blocked for overall great health. So look at this. This is a spine that's out of position. The spine is buckled back, so it's misaligned, and that caused a structural deformation, not only of the spine, but a buckling of the ligaments and also a structural deformation of the disc as well. This disc is bulged over here, so we have C2, 3, 4, 5. 5, 6, a disc bulge here, C5, 6, and a disc bulge here at C6, C7. And now there's compression into the fecal sac. You may have heard that on your report. The fecal sac is what contains the cerebral spinal fluid and the spinal cord, and then also compression onto the actual spinal cord. That's causing a transverse load or transverse strain and stress on the actual nervous system tissues. And guess what comes out of the spinal cord is the nerves. So the nerves that come out of the lower neck go into the shoulder and into the hands and fingers. So this is a big time significant contributor to local neck pain, disc injuries, and as well when that disc irritates a nerve that goes into your shoulders, hands, and fingers, it's a contributor to not just arm pain, but also numbness and tingling. It can be in the arm or right down into the thumb and fingers. So that's what it looks like on an MRI, and you can see how serious it is when there's a disc bulge. So it needs to be addressed. So what I want to show you now in the next segment is these 3 great exercises that I give to my patients, almost all neck condition patients, but especially for disc bulge patients. I want to first tell you that these exercises are best done under supervision of a corrective care chiropractor, a chiropractor of any kind, a physiotherapist, or even your primary doctor that knows your condition very well. So I wouldn't just jump right into them. You should get clearance from your medical doctor or your primary care physician. And if you haven't, then you should get a spinal checkup to see if you qualify for these exercises. I will show them because I know they're great exercises as a demonstration, as a tutorial and educational tool, but you need to do them under the supervision of a doctor that's diagnosed and assessed your spinal condition. So I just want you to be aware of that. So if you're under care with someone already, then you can bring it to their attention and see if it fits into your program. Okay, so it's not for everyone. It's for someone that's been cleared to do this. So that's a very, very important disclaimer that I want to add in here. So I'll jump into these demonstrations right now. Okay, so I'm back. Let me show you these 3 exercise demonstrations. And the first one's going to be a range of motion exercise. And it's going to back up a bit so you can see exactly how it's done. So these will be done in the normal planes of motion for the neck, which would be flexion, extension, lateral bending, and rotation. So very simply, I'll just turn to the side so you can see. The first one will be flexion, extension. Get nice fluid motion, flexion, extension. 5 to 10 repetitions. With any exercise, they're never done if it causes more pain during those ranges, especially at the end range. So just be aware of that. Lateral bending. And rotation. Great, so that feels already relaxing to me. So that helps keep the discs and the joints nice and lubricated and mobile. And of course, they should not be done if they cause irritation or increased pain at that moment. So that's why it should be done under the supervision of a doctor or therapist. Exercise number 2, we're gonna start working with improving that neck lordosis. So what that means is that natural curve of the neck. So a great exercise is to extend the neck back, which induces that lordosis, and then looking to the lateral aspect. Okay, so again, from the side would be extending back and then looking lateral as far as you can. Sometimes you can put your fingers back here and just bend over the fingers and over. Okay, or without, over and lateral. So extend, then lateral. So we're opening up those disc spaces and also favoring the natural curve of the neck. Then you switch the other side. So again, can be done in two single moves, extension and turn to the side, or one fluid motion. Okay, it can be done anywhere from 5 to 10 reps. Exercise number 3 is now using a tool. So in our office, we give patients this exerciser, which is called a prolordotic neck exerciser. It's a stretchy band with a cushion over here. And that goes around the neck. Again, patients have to qualify for this exercise, so you can't just go ahead and do it without being tested, examined, and cleared for this exercise. So we stretch it out, and I can do 3 different directions. One over here, and it helps to really strengthen those muscles in the back, stretch the front muscles, get motion and lubrication to the joints and discs, and promote that natural curve of the neck. Can change to the middle. I can change to the upper area. And you can do anywhere from starting with 15 repetitions up to 30, then working up to 45. So that's a great tool that we give to our patients. Someone at home may not have that, so we dispense it to them, or a towel does the trick. The only thing about the towel is it doesn't expand, it's not stretchy, but same idea. So you can put it here in the middle and then just tilt the neck over the towel. Okay, and then another little trick, some people may have tubing, elastic tubing. So if you wrap a towel around there for cushion and then hold the tubing, and then you get that stretchy effect as well. So there you have it, 3 of my favorite exercises to help promote healthy spine and the neck, especially for a C5, C6 disc bulge. Like I said earlier, you have to be clear for these exercises. I don't just give them to every person. There are certain criteria for when they're indicated, and there's certain criteria for when they're contraindicated, which means when people cannot do them. People are tested for this. They are monitored at my office, and then they're sent home with exercises to do at home under my supervision and my monitoring. Now, the last thing I want to leave you off with is how corrective chiropractic care fits into all this. If you remember the picture with the spine, the neck has a natural alignment in the neck. So there should be a natural spinal alignment. When that natural alignment is lost for whatever reason, that puts compromise on the tissue, such as the nervous system, spinal cord, discs, muscles, and tendons and joints. So we want to rehabilitate that, and we have different corrective protocols that we provide. So there's chiropractic adjustments, there's postural correction adjustments, there's postural exercises, and then tractioning techniques that we do. I'm not talking about decompression traction. Sometimes we do that for arm symptoms. I'm also talking about traction in this plane of the neck to get a curve into the neck. So those are some of the corrective methods that we apply in the office. And that's what makes our office unique and different, is that we apply corrective methods. One of the main techniques I use is called chiropractic biophysics. And I'm certified in chiropractic biophysics, done lots of trainings, and been doing this for several years. And many people have done really well with this kind of work. I've had cases and patients come in where they can hardly walk, but when they walk in with back pains and disc bulges and leg pains, and then within 3 months they're walking again, their spinal alignment is improving. We've had patients with arm symptoms and numbness and tingling, and put them on either decompression or extension traction and help reduce those symptoms and get their life back. So this makes a big difference. The most important thing is that you need to have a proper spinal assessment, which includes a spinal exam, postural exam, couple of neurologic tests and orthopedic tests if necessary, and then of course an X-ray analysis. That will dictate the diagnosis and the corrective protocols, which is exactly what we do in our office. So I highly recommend that you look for a corrective care chiropractor in your area if you're looking for this kind of work. If you want me to help you find one, just comment below and I'll do my best to refer you to a directory where you can find a corrective chiropractor in your area. Most likely more accessible in Canada and the United States, so where most of these docs are, but there are a few in the UK area and maybe Europe and other parts of the world like Australia. So I hope you found this video useful. I would love to hear your comments. Leave a comment below. And if you have a question, let me know again in the comments below. I do my best to answer questions. I do get thousands of questions and comments, so I try to answer, especially the early ones, as quick as possible. And sometimes I answer with a quick text reply. Sometimes I answer with a video. So if you have a really great question, I may make a video out of it as an answer. And if you find this really useful and you think there's someone in your family or friends that may find this useful as well, do share it with them, because it could make a difference for them. And if you're new to this channel, like I said earlier, subscribe, because I love putting out this content to help people in the world get access to more chiropractic care, more knowledge of chiropractic care, and give them some tips they can actually use at home to make their quality of life better and help with their spinal conditions. This is Dr. Walter here. I thank you for watching, and I'll catch you on the next video. To learn more about how corrective chiropractic care at Back to Health Chiropractic Center can help you with your chronic pain problem, visit www.ibthcc.com. Back to Health Chiropractic Center is located at 20 Cranston Park Avenue, number 6, Vaughan, Ontario, L6A2W2.